Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, our topic is substandard and falsified drugs. Dr. Murray Lumpkin worked for the FDA for 24 years and now leads global regulatory systems initiatives at the Bill and Melinda Gates Foundation. We talk about what substandard and falsified drugs are, where they come from, and the real harm they can cause, including death. We also talk about why this market exists in the first place and what can be done to tamp down on fake or substandard drugs globally. Let's listen. Dr. Murray Lumpkin, thank you so much for being on Public Health on Call. First, can you tell us a little bit about the work that you do?
Yeah, hi. And let me thank you for asking me to be with you today. It's a great honor and pleasure. Currently, and for the past 10 years, I have worked and am working at the Bill and Melinda Gates Foundation. I am the lead for what we call our global regulatory systems initiatives, which means that it's work we do with partners around the world to try to optimize the various regulatory systems through which global health medical products have to go in order to be legally bought and used in the lower income countries that we focus on. Prior to that, I was with the US FDA for about 25 years. I'm a physician, pediatric infectious disease and tropical medicine doc by trade, but I've been in this regulatory space for about the past 35 years.
So today we're going to talk about substandard and counterfeit drugs. Let's start off, what sort of falls under the umbrella of a substandard or a counterfeit drug?
Okay. You know, the term that the WHO uses and most people use now is substandard and falsified, because counterfeit is a legal term and it varies from country to country. It often has to do with IP issues and that kind of thing. And that's really not what we're talking about today. We're talking about products that have not been made to the standards that the global community expects when it comes to the quality of the product that's out there. Or it's a product that purposefully is misrepresenting itself as another company's product when it is not really that company's product.
Can you give us an example?
Yeah, as you can imagine, and I think it's for people who have grown up in North America, who have grown up in Western Europe, where there are very tight, very rigid controls on the products that get into the market, it's hard to imagine a world where when you go to the pharmacy, you would get a product that is not what you thought it was, or it didn't have the right amount of drug in it that you thought it was supposed to have, or it might have a completely different drug in it than what you thought, or it might not have any drug in it at all. It might be a capsule basically filled with sawdust. This is what we mean by a substandard product. It's a product that is not made to the standards. It does not contain or doesn't contain the right amount of the active ingredient. And as you can imagine, when that happens, there can be some very significant health consequences by not getting the right amount of drug or not getting any drug at all. And yet, even though many of us have grown up in a world where we don't even have to think about it, we go to the pharmacy, we get our prescriptions filled, and we just know it's going to be a quality product, it's going to have the right amount of medicine in it, and it's going to be what it says it is. But in a large part of the world, that is not the case. And when these substandard products get into the marketplace and they represent a substantial percentage of the marketplace in many of the countries we focus on, it really becomes one of the major public health problems for that country.
Now, are these drugs that I would find, just going to a pharmacy? Are they drugs that I might get if I was going to a hospital? Are they all over?
It depends from country to country because there are, in many countries, different ways that people receive their drugs. Many of them buy drugs in the open market because they don't have the controls that exist in Europe and North America and other parts of the world that have very stringent controls where you have to go to a pharmacy to get it. You could get them from pharmacies, you could get them in government programs. And a lot of that goes back to the difficulty in many of these situations to actually detect that the product is substandard. And so they get into the normal market chain of supply in these countries and thus become a problem.
Well, let's talk about why these drugs exist in the first place. What's the motivation to create a substandard drug, something that maybe doesn't work?
Money. It is the root of all evil, as they say. And this is a prime example of when it does make people make decisions that are quite detrimental to other people. I mean, you can imagine if you are making a drug and you decide, I'm only going to put half the amount of active ingredient in it, but sell it for the full price, there's more money to be made. And when there are not controls to stop that, when there are not real consequences if you get caught doing that, sometimes people do follow their bad angels and make decisions to put these kinds of products out there and put people's lives in jeopardy.
Are there areas or markets where this is a huge problem, like more so than in other areas?
Yeah, if you look at some of the data that the World Health Organization puts out, there are some countries where substandard drugs represent a significant, even up to 50 to 60% of the market. There are others where it might even be 10%, but 10% of the market is a significant amount of product that causes these kinds of problems. Clearly, when you look around the world, the countries that have weaker regulatory systems, the countries that have to import a lot of their drugs, if not all of their drugs, from other parts of the world, the countries that don't have a large amount of money to spend on drugs, and they're looking for bargains so that they can treat as many of their people as possible. This is where you tend to see this happen. And, there were some pretty significant examples of this last year that made the news around the world. And it wasn't, I think from a historical perspective, it was a very interesting, but a compellingly sad commentary. Because if you look, what the problem was, it was in cough medicine and cold medicine for children. And in order to make it go into a suspension, you normally have to put a certain product in there to make the active ingredient go into suspension so the children can swallow it. And you can't put it in a pill for them. Well, what happened in this case last year, the product that you put in to make the suspension, they put in basically what the active ingredient in antifreeze is. And it killed over 200 kids in Gambia. It killed kids in many different parts of the world because even that small amount of that wrong diluent in there causes your kidneys to shut down and you die of renal failure. Well, interestingly enough, this same problem in 1936 occurred here in the United States. And it killed around 100 children in the Midwest. And it was the incident that led Congress to enact in 1938 the Federal Food, Drug, and Cosmetic Act, which is the act that created the FDA that we know today, that said, we're not going to let this happen again. We need to put tight controls on it. And yet you think almost 100 years later, the same thing happened in another part of the world. And that's why I say it's interesting historically, but it is compellingly sad that 100 years later, the exact incident that led to the creation of the FDA as we know it today in the United States still can occur in different parts of the world, and children still die because of this.
And you work with global regulatory systems. Can you talk a little bit about what their reach is for a problem like this?
Yeah, I mean, there is no such thing as a global regulatory system. There is a global regulatory ecosystem that is made up of many, many different parts. And critically, no matter whether it's the United States, whether it's in Europe, Africa, Asia, Latin America, wherever, at the most critical component is the national regulatory authority. So the FDA counterpart in various parts of the world, which has the mission to make sure that the medical products that are available on the market in that country are safe, effective, and meet international quality standards. Now, different ones can do it to a different degree, depending on what their experience is, what their resources are, both human and financial. And many of the national agencies that we work with are newer agencies. They are not well resourced. They do not have the legal authorities and abilities to enforce the scientific standards that they know need to be enforced. And there are others that are working within this ecosystem to try to improve it, because one of the things that's happened in the last 30 years is that medical products have become global commodities. They are shipped all over the world, they're marketed all over the world, they're made in different places, different parts of them are made in different places and shipped. And so you have a lot of opportunities for things to go awry, either accidentally or unfortunately on purpose, if you don't have a system that is integrated where the national authorities work with each other, talk with each other. There are regional groupings of authorities that work together to try to bring the resources that different agencies have together, so that, you know, the sum of the resources is more than the individual components. And then you have groups like the World Health Organization, who both develop the global standards for these products, but also do a tremendous amount of training and work with national agencies and regional agencies to try to help optimize and improve this whole system and all the various components of it. So what we do is we work with all of these different levels. The global level would be like the WHO. Then there are regional levels in different continents and different parts of continents. And then there is the local level within each country, which, as I said, becomes the main focal point, because they are the ones that actually have the legal authority and the ability to do something within their own jurisdiction.
You mentioned earlier that part of the issue here is countries maybe not having the finances to purchase drugs that have gone through this very tight regulatory system. So how much of this problem is a failure to make those drugs easier to procure, to make them cheaper?
Yeah, no, I think you've really hit it. And if you look at the current situation, if you look at the WHO's essential medicines list, which is a list they have created in which they update every 2 years, telling to individual countries, you know, this is the basic minimum pharmaceutical armamentarium every country needs in order to meet the needs of its population. Now, about 10% of those products are represented by products that are used to treat HIV/AIDS, to treat malaria, to treat tuberculosis, that are used for family planning and treating maternal and child health kinds of issues. Those products, for the most part, over the last 30 years, are bought by large global procurement agencies that the larger global community supports. Some of these are UN agencies that people have heard of, like UNICEF and UNITAID, and others are ones that are outside the UN system, but that are global, such as the Global Fund or Gavi, which buys vaccines. And they purchase these for use in low-income countries. Those drugs, these large global procurement agencies require the products that they purchase using those funds to have gone through a stringent regulatory authority of some kind. So there is a greater assurance that those products do meet global quality, safety, and efficacy standards. But that only represents 10% of the entire armamentarium. It does not cover antibiotics. It does not cover cancer drugs, diabetes drugs, cardiovascular drugs. So there are a huge number of products that don't have this kind of large global procurement and quality assurance. Those are the ones that really cause the majority of the problems that we're talking about today. But even some of those that fall, there are times where they don't meet the entire need in a country, and a country has to buy using its own funds, its own versions of those products. And you were asking for examples. I mean, one that I think people can relate to is often when women give birth, there is a problem with bleeding after the woman gives birth. And there is a drug called oxytocin that is often given to try to stop that bleeding. I mean, well, in many parts of the world, physicians know that you generally just have to give 4 times the amount than you normally do because the products probably only have a quarter of the amount of active ingredient. And so, you say, well, does this make it cheaper? Well, it doesn't. They're buying a cheap version, but they're having to use 4 times the amount to get the effect that you need. And in this case, it can often be a life-saving effect. So it is a very real problem on a day-to-day basis. And again, it's one that those of us that had the great fortune of growing up in a country where we don't have to think about the quality of our drugs because we have effective systems in place to assure that, we have to realize that is not the case in a large, large majority of the world. And many of our fellow brothers and sisters on this planet have to deal with this on a day-to-day basis for themselves, for their children, for their parents. And it's a real, real problem.
What's the solution?
Well, I think there are several parts to it, and you've mentioned some today. One is figuring out a way to help countries buy quality versions. People have to realize, as in anything, quality costs. You will find people that will sell you a cheap version of anything, but you get what you pay for. And so part of it is education as to what is going on, what the problem is. Part of it is figuring out a way for those who are purchasing products for a country to change from a mindset of purchase based on price to purchase based on quality. And even more so, building up the regulatory infrastructure so that they don't have a choice but to buy quality, like in other parts of the world that have effective regulatory systems. I mean, people need to know that this is good public health. This is what people expect. And this is what governments and companies and healthcare systems should provide for their people. I know we often think of, if you're going to have a quality healthcare system, you need to have quality practitioners, you need to have quality clinics and quality hospitals. But you can have the best practitioners in the world, you can have the most modern hospital in the world, but if you've got substandard medical products, you do not have a quality healthcare system, And so you've got to realize that having a regulatory system that provides you with these international quality products is an integral part of any quality healthcare system.
Well, Dr. Lumpkin, thank you so much for talking to us about this really important issue. You have certainly illuminated this for a lot of our listeners, and we appreciate having you on Public Health on Call.
I thank you for the opportunity.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.